Hi, and welcome to Your Mouth is the Door to Your Health. I know, it's Dr. Tammy Balatgek show. And Dr. Tammy, if I can turn the tables just a little bit and ask you to be the guest, because I've been watching your series and I have questions.
Awesome.
Does that work for you?
Great. Perfect.
Sleep apnea. You've heard of that, right? I'm starting to think, no kidding, Dr. Tammy, that everybody has sleep apnea. I was first introduced to it very intimately when my son was born. So he had apnea as an infant, which is a little bit different, and that can cause SIDS, sudden infant death syndrome. What I've since learned, and that son is 29 years old, is apnea is really an adult or a lifetime issue in many situations. Is that true?
That is true.
First of all, what is apnea? Can you define it?
Apnea is the absence of breath. So we stop breathing at night, and it usually happens when there's a blockage in the airway. So it can happen if the nose gets blocked up, or the back of the throat, or the tongue. And this picture here shows the different areas that we breathe through and where the blockages can occur. So if there's a blockage there, the air can't pass through from the environment into our lungs, and we stop breathing.
So that blockage can be here in the nasal area or here in the throat area?
Right, or from the tongue falling back into the throat, which is very common.
Because the tongue is blocking it?
Yes, the tongue falls back and the lower jaw as we relax through sleep, and it blocks the airway.
So apnea means your airway's obstructed. Is that a fair statement?
Yes, that you've stopped breathing.
Okay, now here's the kicker. Sleep apnea. If I'm sleeping, how do I know?
That's the big problem. Most patients don't know, or most consumers don't know that they stop breathing. So usually a bed partner will nudge you to say, wake up, or snoring is often a sign of that, because when we have our airway becoming smaller and collapsing, it gets more constricted. The air has to go faster, so it rushes and it vibrates the tissues, and that's what causes the snoring sound. So as it's getting smaller and smaller, the air's going faster and faster, and that's where snoring can come into play.
Is that why often when I want to say often, and I don't know because we're sleeping, but I know if I've experienced it, perhaps you have, you're sleeping and the snoring wakes you up. You're like, you're jarred awake by that. Is it because you're not breathing?
Right, that was another sign that I was going to mention, is gasping awake. So if you awaken with a start or a gasp, the reason we treat this in our office is because tooth grinding and clenching is now being shown to be part of a way to try and open up that airway by moving the jaw and the tongue around. And so oftentimes the patient or the person will wake up but not know why they woke up. And then they may say, I have to go to the restroom, or I had a bad dream, or I'm warm. Oftentimes a lot of patients will sweat with this condition during the night, so they'll wake up sweating. But they're not aware that it's because of the stop breathing.
So we say night sweats, nightmares, gotta go potty, this is why I'm waking up, when really it's because we're not breathing properly. Our body's saying, I need air.
Exactly. Yes, it could be.
Okay, what's the cure?
Well, before we get to the cure, let me just say, in the morning when a person gets up with this condition, they may be so fatigued, feeling like they didn't sleep all night. They may be resetting the alarm or hitting the snooze button. They'll walk around feeling like they're in a fog, have trouble concentrating, get through part of work and have to take a little nap, or a lot of times have to live on caffeine. Our patients will have on their history form that they drink 6 or 8 cups of coffee per day just to keep them awake. So those are some other ways you may be able to think that you have sleep apnea.
Some of those are resonating with me. Actually, multiple symptoms there, and I'm betting, maybe 1, 2, or more have resonated with you. I've heard of this c-pap thing, the c-pap machine. It seems to be. What is that?
Well, your question, what is the cure? There is no cure for sleep apnea. Sleep apnea is a condition that can be treated, but it cannot be cured. So,
I did not know that.
yeah, so once you have it, you pretty much are going to have it the rest of your life and need to do something. So the treatment options available are a CPAP machine, and this is a very cumbersome, bulky type apparatus. This is the mask. So in addition to the mask part, which goes on the face, covers either the nose or the nose and the mouth, there is a bedside unit, and that unit generates air pressure. So you have this air pressure machine at your bedside with hoses that connect from the bedside to the mask, and then you're attached to this hose. So it becomes an issue of position sleeping, where you have to lay in one spot, because if you roll over, the mask is going to break the seal. You can get air that goes into your stomach, so it can become very uncomfortable by wearing it. The CPAP machines have humidity, so you have to add water to them, so there is a lot of maintenance to it.
I got to tell you, if we're talking about getting a better night's rest, that doesn't look like a better night's rest to me, in all honesty.
Yeah, and it's noisy too, so it can affect a bed partner from the noise. Yeah, and the CPAP has been the gold standard and what most doctors will recommend, because it addresses all three blockages. So you can see how it starts at the nose and then it blows air in through the nose and the mouth.
Right.
So that's why it's been the first line of defense to try it as a very first treatment. And recently, the American Academy of Sleep Medicine has issued a statement about dental devices being a first-line treatment for someone with mild or moderate sleep apnea. So that's really exciting for us, because we've had to always be second in line to the CPAP machine. But another treatment option that's available is this dental device. And this is worn in the mouth. It covers the top and bottom teeth. And it's very small and compact. There's no noise or humidity or anything that you have to add to it.
Night and day.
So
between,
yeah, for sure. Yeah. And
does it do the same thing, and how?
Well, the CPAP machine works by blowing air pressure into the nose and throat. So you're basically blowing up the airway like a balloon, so that it can't collapse and close off. The device works, the oral device works by moving the tongue and the lower jaw forward mechanically. So you're stretching the airway open. And that's one slight disadvantage, is that we're working at the level below the nose. So if a patient does have a nasal airway problem, they may need to supplement with breathe right strips, or treating their allergies, or sometimes nasal surgery, having a deviated septum fixed. But it's a very good combination to treat the nose and wear this to treat all the blockages.
Is it also possible you could just wear this? Perhaps you don't have a nasal issue. Perhaps it's just here, then you wouldn't need multiple.
It's very possible. And that's why a good screening and examination is key to pick the best candidates for the appliance, because not everyone will have success with this. But we can tell them up front if there's a nasal issue, or oftentimes in the case of someone being overweight, severely overweight, the neck tissue will weigh more and the appliance isn't enough to stretch that. So there are other combinations too. We have many patients who wear the appliance plus the CPAP when they're at home, and then when they travel, they just take the appliance with them. So
this just seems so much less cumbersome. So you said there's an examination. What are you looking for? If I come and I say, Dr. Tammy, I'm really not sleeping well, and I'm crabby because I'm not sleeping well, and I would pay anything for a good night's sleep.
Sure.
And my husband keeps telling me I'm snoring, and I keep saying I'm not. So what are you going to do?
Sure. We're going to do a thorough history. So we're going to ask a lot of questions about your sleep. We're going to want to know your dental history, because oftentimes someone who's had orthodontic treatment and they've had teeth pulled, now their mouth volume is smaller than what it should be for their tongue. And so the tongue then sits closer to the back of the throat. So we're going to delve into a complete history, and then I'll do a very thorough exam where I'll look at your airway. I can see your back of your throat, the tongue position, and based on the upper arch, the top teeth, I can also tell a lot about the nasal airway. Plus, in our office, we have a dental cone beam scanner machine, which is a 3D x-ray, and it takes a picture of the whole head. So I'll be able to see the nasal airway and know if there's anything going on there.
And so from that, you can determine if this device, which is much better than that, I think, will alleviate the issue.
Correct. Yes, we can give you a good idea of what treatment would be best. And just to mention, there is also a surgical treatment out there where the jaws can be moved forward or the back of the throat can be removed as far as the tissues there. But that's about 1/3 successful because you're only attempting to get out one of the blockages. So that's usually down on the list of treatments after the c-pap and the oral appliance.
So I go through all of this. Perhaps I do determine, or you determine, I do have sleep apnea. This is just something that sits on my nightstand, and when I'm ready to actually close my eyes and go to sleep, I pop it in and I'm good to go.
Sure. You can do your evening routine with brushing your teeth, getting ready for bed, and then if you're ready to go to sleep, you can pop it in, or if you're going to watch TV or do other activities, you can have it on your bedstand and pop it in right before you go to sleep.
Sounds pretty simple, and oh my goodness, the payoff, get rid of night sweats, get rid of headaches, wake up refreshed with a lot of energy. I like it.
Yeah, it's life-changing.
So where do I go?
Yeah. Well, we can be reached at the Center for TMJ and Sleep Disorders. Our phone number is 610-796-2835, and our website is tmjsleepcenter.com.
Wake up like this, ready to go. I love it. Thank you so much for filling us in on this.
Thank you, Joe.
My pleasure.
And I can be reached at 610-796-2835, or our website is tmjsleepcenter.com.